Hello, everyone. My name is Adesua Obasahin Watson, and I'm the Director of the Suffolk County Department of Health Services Office of Minority Health and the co-chair of the Suffolk County Multicultural Advisory Committee. And I would like to welcome you to our video recording of the Virtual Behavioral Health Town Hall series on mental health resources. This series is a collaboration between our Suffolk County Division of Community Mental Hygiene Services, our Suffolk County Multicultural Advisory Committee, the New York State Office of Mental Health, Long Island Field Office, and the New York State Office of Addiction Services and Supports. Before I introduce our main speaker on crisis services, I would like to share a little bit about the Multicultural Advisory Committee, also known as the MAC, and the purpose of this series. So before I get into introducing the MAC, I'd like to go over our Behavioral Health Town Hall partners. As mentioned, this is a collaboration between these four offices: the Division of Community Mental Hygiene, Suffolk County MAC, the Long Island Field Office of Mental Health, and the Long Island Regional Office of Addiction Services and Supports. This is our local behavioral health leadership staff, all of the individuals that have worked on this town hall. And of course, the purpose of this town hall is to raise up the issue of behavioral health needs created by or worsened by the COVID-19 pandemic, reduce stigma attached to living with and seeking help for mental health and substance use, provide a more accessible, community-friendly overview of behavioral health services and resources. And our goals are specifically to break down barriers to behavioral health services for communities and help people understand that mental health is an important part of overall health, promoting wellness and recovery where we live, work, learn, worship, and play. So at this time, I'd like to introduce our main speaker, Dr. David Close, who is from the New York State Office of Mental Health, Long Island Field Office, to discuss crisis services.
Hello. The first slide I'd like to discuss is the mobile crisis hotline services that are provided by the Diagnostic Assessment Stabilization Hub, also known as DASH. The phone number is 631-952-3333, or you could reach or contact the DASH through the email link listed above. Mobile Crisis Team responds to children, youth, families, and adults in the community from 8 a.m. to 12 a.m. They provide mental health and substance use disorder interventions, assessments, safety planning, crisis counseling, linkage to community services, peer services, and follow-up services. The Mobile Crisis Team staff include licensed mental health professionals and peers, unlicensed staff, emergency medical services and mental health professionals, and also involved with law enforcement and mental health professionals outside of the DASH. Next slide. The Diagnostic Assessment Stabilization Hub, or DASH, is located on 90 Adams Avenue in Hauppauge, New York. The phone number for DASH is 631-952-3333. And more specifically, the DASH provides assistance with mental health and substance use or addiction issues. It's a voluntary service that provides crisis and behavioral health services that include a safe place to call, to visit, or have someone come to you for help via the Mobile Crisis Team. Specifically, the DASH helps treat anxiety, depression, substance use or drug use, thoughts of suicide, and other emotional or psychological issues that people are struggling with. It also provides individual and family counseling, medication for mental health or substance use conditions, safety planning for people who are having difficulty manage their depression or their emotions, medical examinations and screenings, referrals for treatment and supports, and substance use services, specifically withdrawal management or detox. Next slide. The Comprehensive Psychiatric Emergency Room, or CPEP, is located at Stony Brook University Hospital on Nichols Road in Stony Brook, New York. The phone number for the CPEP is 631-444-6050. You can call 24 hours a day. And CPEP specifically provides voluntary and involuntary emergency psychiatric services for children and adults in urgent need of psychiatric evaluations 24 hours a day, 7 days a week. Psychiatric evaluations and assessments are included in the treatment process. Referrals to mental health services in the community are also provided. And if necessary, admissions to Stony Brook Hospital or a transfer to a psychiatric inpatient unit throughout Suffolk County is provided by the CPEP. In order to preserve the confidentiality of patients, visitors are generally not permitted within the unit. But there are some exceptions for children. But if you do go with a loved one, you have to be prepared for not being able to see the person until after their assessment has been completed and a determination has been made about next steps for the individual who's in crisis. CPEP is staffed by specially trained physicians, nurses, social workers, and other staff who are committed to providing the best emergency care to each patient who comes in. Next slide. Resources also available include the Family Service League Dash Center 24-hour hotline that is also connected to the Multiple Crisis Response and Stabilization Center. For people who are in emotional distress or feeling suicidal, please call Response, which is a 24-hour hotline at 631-751-7500 or at www.responsehotline.org. Conexión, a bilingual hotline at 631-751-7423, that's open Monday through Friday from 5 to 10, is a response crisis center that offers counseling services to include Conexión, a hotline for Spanish-speaking individuals. Conexión is a nationally accredited non-for-profit service intended for Spanish-speaking individuals who may benefit from support during a difficult time. There's also the National Suicide Prevention Hotline at 1-800-273-8255, or you could text the hotline at 741-741. There's also the Thrive Recovery Community and Outreach Center at https://thriveli.org. The phone number for Thrive in Nassau is 516-765-7600. And for Suffolk County, it's 631-822-3396. There's also a domestic violence, sexual assault hotline, 24-hour hotline that can be reached at 631-360-3606. And for veterans, there's a Veterans Crisis Hotline at 1-800-273-8255 and press 1, or you can also text at 838-255 for the Veteran Crisis Hotline. And finally, New York Project Hope, which is an emotional support helpline, can be contacted at 1-844-863-9314 or at newyorkprojecthope.org/providers/. Next slide. For substance use crisis services, you can call the Hope line at 24/7 at 1-877-8-HOPE New York. That's HOPE New York, or text at 467-369. For more information on the New York State Office of Addiction Services and Supports, also known as OASIS, please visit the general website at oasis.ny.gov. Next slide. There's also the Suffolk County Directory of Behavioral Health Services that provides information regarding mental health and substance use programs in Suffolk County at the email address on the screen. There's also Stop Addiction at SuffolkStopAddiction.org. If this is a medical emergency, a suspected overdose, or if you're experiencing thoughts of harming yourself or others, please call 911. Next slide.